Achieving the MDGs on health require a unique approach that addresses the health needs of the rural poor by bringing health care to the doorstep of the less privileged. The FCT MDGs Office is looking to sustain successes recorded in this sector through the Mailafiya healthcare delivery service by introducing a community-oriented health insurance scheme. The idea is that beneficiaries of the Agricultural Empowerment Initiative would commit a fraction of their income to secure healthcare services for their immediate family. This kicked off with studies and surveys of households in the FCT communities. Information gathered from these studies was essential in starting a pilot scheme of the community-based health insurance scheme in the FCT. This is a result of vigorous advocacy and sensitization in all the area councils to enlighten and educate the target communities. Some members of these communities were trained so they can train others. The pilot scheme involved 60 communities, made up of 10 communities per area council. These communities have few functional primary health care centers, and where there are no PHCs, the mobile health team, tagged Mailafiya, pay frequent visits. Presently, 10 communities are on the first phase of the pilot scheme, while 10 more communities are currently being incorporated into the second phase. The scheme is already breaking new grounds in health delivery in Nigeria. Chief Angulu Dogo is the village head of Sarki of Kango, a community in Kuje Area Council. He is 85 years old and has been ruling his people for almost 30 years now. In all those years, he said he has never benefited anything from the government until the coming of the FCT MDGs Agri Empowerment Initiative, and now with the community-based health insurance scheme kicking off in his community, his people are indeed grateful.
The chief of Congo community expressed his gratitude to the MDGs program that has been introduced to his community. And the chief himself in particular, he appreciates of what MDG program has done to his people. The MDG program has touched the life of Congo community entirely in terms of providing a tractor and a seedling, and the same time providing fertilizer for his community. And for that, they have been harvesting their farm product, and the farm product is being sold, and the money is being back to the farmers. And he appreciates that for what MDG has done for the entire community. At the same time with this, he sat down one day and just people just came with through MDG program that they have a program that under National United Health Care, that is, they came, their aim and objective is to give us the awareness of about our health. With that, they give us cards that if any one of us is first sick, that we should take the card to the nearest health center. That he appreciates the MDG. They should take heart and also do wonderful thing that they are doing to his community. And the same time is appealing to MDGs that with this program, they should extend and give us a primary health care here. Because our children, our people, they are being suffering in terms of sickness. Some they can't have money to transport themselves to Kuje, but some they have, but some didn't have. So he's appealing to MDG, they should provide health facility in Congo community.
Sarki Kango is blessed with 21 children and 3 wives. All of them, and even his over 100 grandchildren, are now registered to enjoy the health insurance scheme. One of his children is Prince Zephaniah Dogo. He serves as the focal person for the scheme in Kango community and has registered almost 200 individuals, including his children.
Early this year, they came and meet our dad at the chief palace. They tell them their aim and objective of this program, that the program is all about our health. Because human being, if you eat and food, one day you may fall sick. That this program is for our own health and is for our own good benefit. And with that, we handle the program as we handle the MDG program. So with that, they give us a forms. We went to a training and they give us form, and they will register as a household. You have to register you and your wife and your 4 children. Out of that, the number is 6 in household, and for that you pay 1,500 naira for the issue of a card. If you still have a dependent, you still have to register that you want them to join this to benefit this program. You have to register them, and per person you have to pay 300 naira. And with that, our people have been compliant. Some did comply, but those that comply, in short, now they have something very tangible to even bless the MDG program. And with that, with this introduction of a card, I personally, I was first sick last 2 weeks, and with this card, I was treated, and now I am sound. And the same time, my wife too, she was pregnant, and it was last 3 weeks that she delivered a baby boy. And it's through this program that the baby is sound and well. And the same time, I still have my daughter, Akbare Zifania, and she was fell sick last month, and I took her to primary health care at Kuje. So they treated her, and she's fine. And likewise, this is my elder brother's wife, Abigail Solomon. She's one of the beneficiaries too. Every 2 weeks, with this Mailafiya people, they do come to our village Monday, Wednesday. If you have a complaint of sickness, then you take your card to them, they will give you medicine and they will treat you. And this is my second wife, brother, my elder brother's second wife. Her name is Hawa Solomon, and she was one of the beneficiaries too. In terms of sickness with their card, if they are sick, they will take the card to the primary health care, and they will give them their medicine. And likewise, this is his son. He was having one umbilical that had been something that nature, and he was operated through this MDG program. And with that, before he did not even know how to even walk himself for him to even run. But now he's fine due to this program. And this Alaje Solomon, she's one of the beneficiaries, and she's holding her card. And in terms of sickness, she do go to the Mailafiya people, and they will give them medicine. And this Ayolo Solomon, she's one of the beneficiaries too. With this program, in short, we have something very tangible to even say that we are grateful and more than grateful. And this Good Luck Sunday is one of the beneficiaries too. In terms of sickness, they do take their card to the various this thing. And this is his mother, Tabitha Sunday. She's one of the beneficiaries with her son. The same thing, she has a card, and all of them, in terms of their sickness, they will take the card to the various this thing. And this is my mom, the third wife of Chief of Congo. She's holding her card in terms of sickness. So she's one of the beneficiaries too, and they have their card in terms of sickness. They do take the card to Mailafiya people, and they are giving them medicine. And this Ayodo Serki is one of the grandson of grandchildren of the chief. Is one of the beneficiaries too. In terms of their sickness, they do carry their card to the Mailafiya. And this is my mom. She's one of the beneficiaries too. In last 3 months, I take her to specialist hospital, and they treated her. She was having eye problem, but gradually, as old age come, that one, nobody can tell. It's only God that can heal the problem of the eye. But they try their distance, and they give her medicine, and she's fine now. And this is the first wife of the chief. And Juma Serki is one of the beneficiaries too. She was first sick, and with this card, they treated her well. This Baiwa Solomon, she's one of the beneficiaries too. With this program, in short, we have something very, very tangible to say that we have blessed. With this program, in short, in terms of sickness, our health problem has been reduced. But the complaint that I want to throw into this program is that our people, in terms of pregnancy and child delivery, our women do suffer because we don't have primary health care in our community. With this introduction of something, I am appealing to the MDGs to forward our complaint to the appropriate authority that we need a primary health care in our community, so that our people will benefit more than this, so that those that they were saying that they don't have interest of joining us, so that they should join us, so that we should move our village forward. And the third complaint is that our drinking water is totally poor. Because of that, our women do go to a river and fetch a stream water, and sometimes we are defecating with the blood, urinating with the blood. So that my complaint is that let the MDG forward our complaint to the appropriate authority that the drinking water that our people have been taking is totally bad. So thank you.
The community-based health insurance scheme has been practiced in many countries for many years with success stories. The FCT Community-Based Health Insurance Scheme is an innovative concept and the first of its kind in Nigeria. The personnel at the PHCs are being trained to correctly capture vital health data using notebooks, which will then be uploaded into a database both off and online. Johanna Dogo and Etu Solomon will never forget what they have benefited from the health initiatives of the FCT MDGs Office. Johanna has registered 15 members of his family to be part of the community-based health insurance scheme. He said the project has made him realize that government is working.
Since we are there here in this Nigeria, we never get any government that will come so that we beneficial like this one. We don't know my government is there. By this year, we know that yes, that is helping there for government side.
Little Etu Solomon had a free operation to take care of umbilical hernia 5 months ago. The procedure was successfully carried out free of charge, with Dr. Emmanuel Okpetu monitoring the process all the way.
The communities are linked to certain health facilities where they access care, minimum care. There's a basic package of care based on the National Minimum Health Care Package. So they can access those basic package of care. And sometimes they won't get more than the minimum package. And they are linked to that health facility, and to even health facilities where they are not, communities that are not very close to health facilities. There's an arrangement for a mobile team to meet them. So the selected communities seem to be properly covered. And a case, for example, in this primary health center that I oversee over this period is Kango. The Kango community is not too far from this primary health center. They don't have a primary health center for themselves, so they come here to access care. So all the enrollees, all the community members who have been enrolled in the community-based health insurance access care here, and I'm sure you go to the community to find out for yourself. They seem to be quite happy about the development because before now they have to access care by out-of-pocket expenditure, which sometimes is catastrophic. A case in one of the examples I can actually bring during the pre-pilot phase of this community-based insurance is the case of Etsu Solomon, who had a huge umbilical hernia. Even though surgeries are not covered in the minimum basic package, but because it was a pre-pilot phase and we needed to gain trust from the community, and with also the intervention of the senior special assistant to the president on MDG and the FCT MDG project support unit, the boy was able to access initial evaluation with us and referred for surgery, and the surgery was done free of charge. And so and the community cannot forget that particular experience. I was personally involved because I did the initial evaluation and subsequent referral and did a follow-up after the surgery was performed. So it's a welcome development because even though the communities pay some sort of contribution for them to they form cooperatives and contribute to the insurance scheme, the government through the MDG office of FCT subsidize their contribution so that it's good enough for them to access care from the insurance and the HMOs, and then they use our center as the service delivery place, and we get a capitation of payment from the insurance company for the enrollees, and also there is also drugs and supply support from the project support unit. So it's a win-win situation for the communities. They avoid catastrophic expenditure for health. They don't need to sell anything. They just come and access basic care, and at some point they also get care on referral, like the case I just mentioned. For the health facility, it helps improve our services because there's some stipends coming in, which is regular, and basic equipment, figs, stethoscopes are not much of a problem. Then there's not stockouts are not envisaged anymore because we have more like a running costs.
The FCT community-based health insurance scheme has encountered some challenges, even though it is still in the pilot phase. The subsidy government is paying per household in each community is quite huge. Some advocates say this laudable project should be assisted by parent body NHIS and also through grants from donors.
We didn't tax them very well. We realized that even though there's some significant improvement, we said per household they should pay 1,500 naira, and the government is going to give 13,500 as subsidy because we realize the cost of care per household using Mailafiya platform, and other studies is 15,000 per year. That's in the low income resource setting. 15,000 naira per year. So if the community, the household in the community can contribute 1,500 and government is bringing 13,500 naira, it's a welcome development. And many communities have shown interest. They've been contributing, they've been wanting us to reach them.
I strongly register my wife and myself and my children. Likewise, after that, the card has been issued to us, and in terms of payment of sickness or drug money, there is nothing like that. With this card, they give me drug free. With this card, they can treat you. If it is in terms of operation, they can treat you. So, and with that, we don't have much complaint about that. But the problem basically is financial problem. Some they were they were eager to register, but due to financial predicament, some they can't raise 1,500 naira. So my appeal is that United Healthcare, they should look at this program of 18, because it came to a rural area. It's not something that the urban people that they are wise. Rural area, we have a problem of illiteracy. So they understand the benefit of the program. So we want the MDGs program to extend their distance. If they can lower the amount of money or to reduce the money to a minimum level, so that our people will benefit more. Because some people are eager to register, but they cannot raise 1,500 with their dependents. Because some in a household, some they are more than 100 in their household. And if they register like 6 people, the remaining people, for them to raise 300 naira, it will be very hard for them, and that make people not to participate. So my appeal is that the government should look into this program and also bring the money, at least if they can be able to raise, to break the money into 2 segments, like 1,000 or 800, so that our people will be benefit.
The FCT MDGs community-based health insurance scheme has been lauded as the way forward to ensure that the presidential mandate of universal health coverage by 2015 becomes a reality. The scheme is also proving to be a major component towards the achievement of the MDGs on health in the FCT. Since the taking off of the pilot scheme for the community-based health insurance scheme in some FCT communities, many beneficiaries have been able to access health care in their communities, and in a few cases, there have been referrals to secondary health facilities as witnessed in Kwali and Buhari area councils respectively. Board of trustees have been established per community. The community-based health insurance scheme policy and work schedule of the desk officers have also been outlined. 3 customized ambulances have been procured to convey emergency cases to the nearest health facility. Also, special tents have been provided to ensure privacy when doctors are consulting with Mailafiya patients.
Yeah, the innovations we've been trying to come up with, particularly the ambulance issue, we have discovered that the ambulance we are using in the FCT are the ones that do not get to the rural communities. So what we decided in 2011 CGS, we talked to CFO Motors, and the Pajero Jeep was converted to an ambulance because we believed it's only that kind of a vehicle that can get to rural communities where there are patients that need to be moved to a tertiary or secondary facility. That ambulance can go in, pick the patient. Even if it is a very bad terrain, the ambulance is suited for that kind of environment to move the patient to a facility where the patient can be attended to easily. The tent is expected to provide privacy, because what we've discovered is that when the Mailafiya team is providing service, some of the consultations are done in the open, and patients require privacy. So it's obvious that the tent is going to assist. The patient can talk to the doctor one-on-one in a private. That was why we decided to say, okay, let's provide a tent so that the patient can have privacy with the doctor and be able to tell the doctor all the things he requires to hear about the patient. So that is the essence of providing the tent, is for privacy between the patient and the doctor. And I think that will also ensure that patients come and see doctors, since there is privacy, rather than the open where everybody sees the doctor talking to the patient.
Join us next week as we focus on the FCT MDG's Youth Empowerment Program and how it is building a sustainable rural development program for youths in the rural communities of the Federal Capital Territory.
Today